we're going to be discussing and treating tennis elbow using Iastm. And today we have with us Daisy, and we're going to be working on her tennis elbow today. Tennis elbow is a condition where the tendon that attaches in on this part of the elbow right here, it gets to be very inflamed. And the tendon can become, it can develop scar tissue or adhesions over a period of time. It's very painful in this spot, and sometimes even other areas in this area as well. It gets difficult when we're holding, grabbing things, even doing computer work, of course playing paddleball or tennis. So that's what occurs, and all these muscles on this part of the forearm in here usually are overused, playing tennis, typing a lot, or tennis elbow can be caused from a trauma. If we fall, it can also cause injury to the tendon that inserts on the lateral epicondyle, which is right in this area of the elbow. So we're going to be using today this instrument. This is an instrument with a technique we use, which is called Iastm, and that stands for Instrument Assisted Soft Tissue Mobilization. And we're going to use this balm right here, this cream in this area. Okay. Now, tennis elbow can be acute or it could be chronic, right? So if it just happened recently, there might be a lot of swelling and inflammation. We're going to be very gentle when we do use this instrument if it's an acute injury. We might only do it for a few minutes. We're going to also want to make sure that we use ice, and we want to rule out, if it is a trauma, making sure there are no fractures or any contraindications where you would not want to do this technique with a patient. I use this in the office a lot with more chronic tennis elbow conditions. All right, so what we're going to do is we're going to start out here and just gently starting at the lower part of the forearm. How does that feel, Daisy?
That feels good. Yeah. What exactly are you looking for when you're doing this technique?
Great question. So when I'm using this instrument, I'm rubbing it across the surface of the skin. And when I hit a little bit of a bump or a change in the muscle texture, that lends me to investigate further that there might be an injury in that area. So we want to be looking for that as we're just scanning around in the areas around the elbow and the forearm here. Sometimes what I'll do is I'll have the patient put their wrist down to stretch those muscles more, or even grab your fingers and curl them and then lift the wrist. Yeah, just like that. And you could feel that tighten up a little bit more. Great. Okay. So we're going to do that. I like this instrument because it's curved in here. It has this curve, which neatly fits on into the arm in this area, so I can get more surface area across the arm while I'm doing this. And we want to make sure that we're especially getting the area that's by where the muscle attaches in the tendon, because that's usually the area that needs it a lot. We would do this, if it's a chronic condition, about 8 to 10 minutes. We would vary our amount of pressure. In the beginning with patients, I go softer. We also can change the angle that we use this instrument this way. So when I push in and I angle the instrument this way, it can be go a little bit more deeper and for more deeper type of treatment in that area. So feels pretty good.
Yeah, it feels really good.
Cool. Right. So the other thing that I recommend my patients, after we do the treatment, I usually have them ice for 10 to 15 minutes in the area that's sore. It's normal for the skin to turn reddish or even some slight bruising. That's common as well. For tennis elbow patients, I recommend they do a home stretch where they put their hand supporting their other hand here, yeah, just like that, and just kind of let their wrist down like this. They can curl the fingers underneath like she's doing, which will get even more of a stretch along these muscles, these extensor muscles right in there, okay? Now what we're gonna do, we're going to adjust her spine. Spine-related issues can cause extremity dysfunction or extremities not to function biomechanically as well as they need to. So we're gonna get cracking right now. And what I'm checking for when I palpate is checking for the springiness in the spine. Are the joints moving as I'm pushing into them? Or are they just resisting me and not have that and don't have that springiness? I'm also going to look at different postures and look and feel the muscle in and around the spine. Do I have more tightness on one side versus another? So that's important. Checking range of motion. Good. On the neck. Great. Okay. And I'm going to have you just rotate. Great. Great. Okay. And normally in our office, we would do a full exam, which would include x-rays if necessary. We would do orthopedic tests. We would check to see if there's any changes in sensation in the skin or any other nerve involvement. And also importantly, to make sure that there's no contraindications where it's to make sure that the patient is safe to adjust. So we're going to start right now with the adjustment. I'm going to have you face down right here. Okay. Like your sneakers.
Thank you.
All right. Okay. Good. I'm going to have you face me this way. Bend this leg, straighten this leg. Good, I got you.
Oh, that was
Right,
good.
that went easy peasy. Lay on your back for a sec. Great. Everything's moving really nice and easy. Right here. All right, great. I'm gonna have you face down on your stomach. All right. Great. Okay, awesome. Daisy, I'm gonna have you come on up and let's sit right here. Okay, great. So, how was the adjustment? How did it feel?
That was really good. It felt really relieving. It was good.
Awesome. And the treatment with the tennis elbow, that is similar how I would do the treatment on someone else that would come in the office. Again, there are a series of treatments with treating the tennis elbow. It's also important to not do the activity that caused the tennis elbow. So we want to make sure that the work we do doesn't get undone when you go home. So we also educate patients on looking at what they're doing and investigating those causes to make sure that they don't re-injure themselves when they come home. And again, if you felt that this video has been informative, entertaining, educational, please hit the like button below. Leave a comment if you're interested in learning about other things as well, and subscribe. That's it for today, and have a great day.